Good day, everyone. My name is Sir Alan M. Manaloto, and for this subject, NCM103, or your Fundamentals of Nursing, this is the lecture part. I will be discussing Chapter 1, the Introductory Concepts. We will start with Lesson 1, the major topic of Chapter 1. It is about the concepts of man, health, and illness. Let's begin by defining what is man. So man is an individual with vital reparative process to deal with disease and desirous of health, but passive in terms of influencing the environment or nurse. So when we talk of man, we are referring to the person or to the individual that is capable of repairing oneself, meaning physically or physiologically, yung katawan natin has the ability or capability to repair any damage or any wound that we incur. For example, nasugatan ka, nadapa ka, for instance, our body can repair that wound, 'di ba? Kaya meron tayong wound healing. And the concept of man is definitely very important for us nurses or in the profession of nursing because the man is basically the our client. They are what we call commonly as the patient that we are taking care of. Okay, so the concept of man forms the first foundational component of nursing. So kagaya ng sinabi ko, it is the man is the person that we are taking care of. They are our client, the patient that we commonly refer to. Next, when we talk about health, according to Florence Nightingale, commonly known as the lady with the lamp, mamaya matatakal pa natin siya, she defined health as a state of being well and using every power the individual possesses to the fullest extent. So, alam naman natin si Florence Nightingale is like the the founder of nursing or parang she was the first who started um, nursing the sick people during the Crimean War. Okay, so ito yung kanyang definition of health. So, using every power the individual possesses to the fullest extent. Later on the latter part of my discussion, makikita pa nyo what are the other definitions of health according to Nightingale. And for World Health Organization, they defined health long ago, 1948. It is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. So, ibig sabihin, kahit na ang isang tao ay may disease, we can still consider him healthy as long as nakakapag-function siya ng ng kanyang ng kanyang pang-araw-araw. He or she is capable of functioning or performing his or her function or roles as a father, as a brother, sister, or anything, nakakapag-perform pa rin siya. So, ibig sabihin, according to the World Health Organization, health is not merely the absence of disease. Okay? Hindi ibig sabihin na wala kang disease, ikaw ay healthy. Okay? So, even though na ikaw ay may disease, still you can consider yourself healthy as long as you can perform your your function or still you consider yourself as healthy. Okay? And then for illness, when we say illness, this is a highly personal state in which the person's physical, emotional, intellectual, social, developmental, or spiritual functioning is thought to be diminished. So, ibig sabihin, nababawasan itong mga aspects na binanggit dito in terms of functioning. So, physically, for example, you are ill kapag hindi ka masyadong nakaka-perform or nakakagalaw physically or nagkaroon ka problem emotionally. So, you can be considered or it can be considered as an illness. Okay? So later on, we are going to dive deeper into these definitions. Now, what are the different factors? So let's talk about the different factors and issues affecting health and illness. So there are many variables influencing a patient's health beliefs and practices. So we have internal and external variables or yung tinatawag nating internal and external factors that influences our health, how we think and how we act, which definitely affects our health. So isa-isahin natin. First, we have the internal variables. So under internal variables, we have developmental stage, we have intellectual background, perception of functioning, emotional factors, and spiritual factors. So for the these are internal variables. Pag sinabi nating internal variables, these are innate factors, meaning nasa nasa sa tao ito. Okay? So it's a personal factor. Okay? It's within ourselves. So developmental stage, this is the person's thoughts and behavior patterns change throughout life. So ito yung ating developmental stages such as from infancy, you have your preschool, you have your school age, you have your um, puberty, adolescence, adult, and then you have your the late adulthood. Okay, so eto na malaking effect ito when it comes to our health and when we talk about of illness definitely. So as we age, definitely mas dumarami, mas nagiging prone tayo to a disease or to an illness. Another intellectual background. So definitely, this is about the person's knowledge, the lack of knowledge, or incorrect information about body functions and illness. So ito yung ating kaalaman when it comes to health and illness, yung ating perception, yung ating beliefs about health and illness. Perception of functioning. So ito yung way people perceive their physical functioning. So, ibig sabihin, if you perceive yourself as you are physically strong, mentally healthy, then, or if you perceive yourself as resilient din, ikaw ay matatag na tao, then that also affects your health and illness. Okay? So, your perception kung gaano ka katatag, kung gaano ka ka-purposeful or ka-functional, that's also an important variable or factor. Next, you have emotional factor. So this pertains to the degree of stress, depression, or fear which can influence health beliefs and practices. So kung ikaw ay madaling ma-stress, kung ikaw ay madaling ma-depress, madaling matakot, so that could also be an influence that would affect your health or illness. And then spiritual factor. So definitely this is in terms of our faith, in terms of your religion. Okay, so that definitely affects your health and illness. Okay, so this also includes your values and the beliefs that you exercise. Okay, so these are all the internal variables. Now let's talk about external variables. So for external variables, you have family practices. This is the way that patients' families use healthcare services generally affects their health practices. So if, for example, your family is oriented to seek healthcare most of the time, so definitely maa-adapt mo din, makukuha mo yung practice na yun. So, how your family involved you or perceive health and healthcare delivery system, so that is an external variable and that could also affects your health and illness. So, kung ano yung nakagawian ng inyong pamilya. alam naman nating family is the basic unit of the community, right? Kaya and family is very important in terms of the health of an individual. Socioeconomic factors. So this pertains to social and psychosocial factors that increase the risk for illness and influence the way that a person defines and reacts to illness. So socioeconomic factors, socio, it is something, or social, it is how we interact to other people, how we communicate to other people. And then economic factors, this is something to do with financial or your economic standing sa ating community. So definitely, the higher your status economically, the better yung inyong access to health. Okay? So yung mga mahihirap, yung mga hindi kaya maka-afford ng health services because of the price. So definitely that affects one's health, and that is an external variable. Cultural background. So this pertains to beliefs, values, and customs. So ito yung mga like yung ating tradisyon, yung nakagawian na kultura, yung mga yung beliefs ng iyong pamilya, ng inyong community, or ng isang group of people. Okay? So definitely um, that also has an influence to a person's health. Okay, so and then we have so there these are the three external variables. So family practices, socioeconomic factors, and cultural background. So yun ano, please be guided. So again, we have internal variables and you have external variables that affects one's health and definitely illness. Okay, so now we will be discussing under the first major topic. We are going to discuss a subtopic and we are focusing specifically at this point sa individual health. Okay, so individual health. So it includes person's total character, self-identity, and perceptions. So, person's total character, it encompasses behaviors, emotional state, attitudes, values, motives, abilities, habits, and appearances. While person's self-identity encompasses perception of self as a separate and distinct entity alone and interactions with others. Okay, so again, now we are talking about individual health. So this is very personal and definitely it's about the person's totality in terms of character and self-identity and perception. Now, the concept of individuality. So to help clients attain, maintain, or regain an optimal level of health, nurses need to understand clients as individuals. So kayo, kapag nurses na kayo and now as a student nurse, so definitely you have to treat your patient or your client as an individual or like give them an individualized care. So especially we are dealing with health, we are dealing with life. So dapat we have to understand the concept of individualism wherein we give patient or we take care of our patient based on their specific needs, based on their personal needs. Wala tayong like one size fits all or hindi masyadong applicable yung tinatawag nating one size fits all in taking care of our patient. So again, consider this the concept of individuality wherein we take care of the patient highly individualized. We take care of them, we give them nursing care personally or in the concept of individuality. Next, ano naman yung concept of holism? So this is about as nurses, concerned to an individual as a whole, complete or holistic person, and not as an assembly of parts and processes. So pag concept of holism, we are looking at the person holistically. Okay? Not just physically, not just emotional aspect, not just their mental aspect, not just their spiritual aspect, but we look at the person holistically. So nagpo-provide tayo ng care hindi lang, for example, physically, but we also provide care in all of the aspects na nabanggit ko kanina. Okay? So, yun yung holism na tinatawag. As a whole tayo. And that is very important in taking care of our patient. Okay? So, hindi fragmented yung care na may bibigay natin sa ating pasyente. Next, let's talk about the concept of homeostasis. So, pag sinabi natin homeostasis, this is about balance. So, this was first introduced by Cannon in 1939 to describe relative constancy of internal processes of the body, such as blood oxygen and carbon dioxide levels, blood pressure. So, ibig sabihin ng homeostasis is here. So, we have different terms pa muna na we have to define, okay, so that we can completely understand what homeostasis is. So, equilibrium, when we say equilibrium, it also means balance through adaptation to that environment. So, pag sinabi equilibrium, balance, this is through the adaptation to one's environment. Okay, so that's equilibrium. Homeostasis is the tendency of the body to maintain a state of balance or equilibrium while continually changing. Alam naman natin that our body, along with many factors, 'di ba? It constantly change. And during that change, our body should maintain balance between good and bad changes na nangyayari sa atin. Okay, so the concept of homeostasis is that our body should maintain that balance um, in one's health, okay, and then definitely to maintain health. So we have two concepts of or two things that we have to know under homeostasis. You have physiological homeostasis and psychological homeostasis. So physiological, it means that the internal environment of the body is relatively stable and constant. So physiological, we are referring to physiologic or to the functions of one's body. So dapat when we talk of physiologic, so this is the internal environment of the body, maintaining the balance, okay, and maintaining that health that we desire. Psychological homeostasis naman refers to emotional and psychological balance, okay, or state of mental well-being. So yun naman yung aspect ng psychological homeostasis is the balance in the aspect of emotion, psychological, and the state of mental well-being. Okay? So, yun. So, basically, pag sinabi natin, the core concept is homeostasis. So, when we say homeostasis, this is the, our body maintaining the state of balance. Physiologically, this is the balance within our internal environment, within our body. And then, this is the physiologic, this is the functioning of our body. While psychological, it refers to the balance of our body in terms of emotion and psychological. Okay, now let's further discuss first the physiological homeostasis. So again nasa concept of homeostasis na tayo. Specifically, we are going to discuss physiological homeostasis. So we have four main characteristics for physiological homeostasis. Okay, to maintain that balance. So we have four characteristics. Our body has these four characteristics. First, they are self-regulating, meaning our body can self-regulate without us even asking. Kahit hindi ka magtanong, kahit hindi mo sabihin sa katawan mo, your body will maintain that state of balance. Okay? It is capable of self-regulating. Kung for example, ikaw ay tumakbo ng mabilis, so definitely your body will need more oxygen and your body will self-regulate by you breathing faster. So that's one way to compensate for what you are doing. Okay? And doon na ipapasok din yung number two. They are the body, they are our bodies, they are compensatory. Okay? Pag sinabing physiologic, again, physiologic pa rin to, ano? Pag sinabing compensatory, tend to counteract conditions that are abnormal for the person. So, for instance, yun na nga, tumakbo ka ng mabilis. So, definitely, your body will compensate by increasing your respiratory rate or your breathing, your respiration because you need more oxygen. Okay? Now, in terms of the abnormal condition naman, so, for instance, high blood, na high blood ka, you have this high blood pressure. So, your body has the tendency to compensate on its own. Okay, gagawa yan ng paraan muna para makontrol yung blood pressure. Such as, for example, idadilate niya yung blood vessel. Okay? Pero pag ang tendency nangyayari is kapag hindi na kayang kontrolin definitely, so doon na pumapasok yung sickness, okay, or yung illness na tinatawag natin. Pero in general, our body can also compensate kapag ka may naging abnormal sa atin. Okay? Our body will compensate first to maintain that balance pa rin. Number three, they tend to be regulated by negative feedback mechanism. So 3 and 4 is somehow interconnected. So 3, it's about negative feedback mechanism. 4, they may require several feedback mechanism to correct only one physiologic imbalance. So for this, ang katawan natin, class, can ano can again compensate, 'di ba? Na-discuss natin can compensate and can self-regulate. And definitely, this is with the help of the positive feedback mechanism and you have your negative feedback mechanism. So, in a nutshell, pag sinabi natin negative feedback system or mechanism, it's the way of our body to correct kung ano man yung abnormality na nararamdaman natin. So for example, an example of a negative feedback system is kapag tayo ay nagkaroon ng high temperature, tumaas yung temperature mo, for example, nagka-fever ka, so your body will be regulated through negative feedback system kung saan magko-compensate yung katawan natin. For example, magsi-shiver ka to release excess heat that you have. Kaya tayo, for example, nanginginig or nagti-chills minsan, di ba? Kapag tayo nilalagnat because that's one way for our body to compensate para ma-maintain yung balance. Okay? And that's a negative feedback mechanism. Yung positive feedback mechanism naman, another way to maintain balance is for example, nagkasugat ka. So definitely, for example, open wound, and then nag-bleed ka, nagkaroon ng bleeding. So the positive feedback would be, there will be a platelet release in your blood vessel or along your blood to 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 stop the bleeding na on that site or on the wound, so that definitely hindi ka maubusan ng dugo. So that release of platelets, okay, on the site of the wound is a positive feedback mechanism kung saan ini-increase yung or the platelet is being released on that site, and then to prevent bleeding, to stop bleeding. Okay? That is during pag tayo ay nagkaroon ng sugat. Okay? So that is the positive feedback mechanism. So actually, this is the major, I mean, these are the two systems or loops, kung tawagin, or feedbacks that we have, which helps in maintaining the homeostasis in our body. Next, we are after the four characteristics, we will be discussing the two general types of systems. You have closed and open system. So pag closed system, ito yung closed talaga, wherein the system does not exchange energy, matter, or information with its environment. So it receives no input from the environment and gives no output to the environment. As in closed talaga. Okay? So, for example, may container tapos sinarado mo, so definitely walang papasok na hangin, wala ring lalabas na hangin from the container kasi nga you close it very tight, for instance. So that can be a simple way of explaining a closed system. Okay? As in walang papasok, walang lalabas, no exchange of matter, no exchange of energy or information with its environment. Whereas pag sinabi nating open system, so ito naman yung kabaliktaran, wherein there is an exchange of energy, matter, and information. So it is moving into and out of the system through the system's boundaries. So ibig sabihin, um, tayong mga tao, we are an open system wherein we exchange energy, matter, and information with our environment. Okay, so now we have, under the concept of open system, we have input, output, and feedback. So input definitely consists of information and material absorbed by the system. So input, ito yung pumapasok sa system, sa isang sistema. Okay? A material that enters the system. Output, it is a system is energy, matter given out by the system. So definitely, ito naman yung output, ito yung mga nilalabas na energy, matter, or information. Okay? For example, natin, towards the environment. And then feedback, this is the mechanism by which some of the output of a system is returned to the system as an input. So, di ba meron tayong output, di ba? So, some of the output na nire-release natin to the environment goes back to us as a feedback. Okay? So, later I will show you the figure. Let's just go back to the throughput. Itong throughput, after the input is absorbed by the system, it is processed in a way useful to the system. Yung throughput, kapag na-absorb na ng katawan na, for example natin, yung energy or matter. So the way na yung processing of that energy or matter in our system to make it useful, that is what we call as throughput. Okay, so this is the diagram. So we will start, it is a cycle naman, so you can start anywhere. So definitely, pero basically, we start with input. So definitely, we get energy or information from our environment. Lahat ng pumapasok is input. And then, pag pinrocess na ng katawan natin yon, okay, at naging useful, we call that as throughput. Okay? And then, after some processing, definitely, yung katawan natin naglalabas din ng energy, naglalabas din ng matter and information, and that now becomes our output to the environment. And then again, some of the output na nire-release natin goes back to us as feedback. And then the cycle continues. Okay, and then kagaya ng binanggit ko kanina, no, yung sa feedback natin, negative feedback mechanism and positive feedback mechanism. So, yun, yung feedback, we have two types in nga, no? Negative feedback and positive feedback. Pag negative feedback, it inhibits change, and positive feedback, it stimulates change. Okay, so this is the um, general types of systems. So how a system, this is under open, ano, yung diniscuss natin input, output, and feedback. Okay, so again, for the two types of system, you have closed and open system. Tayo as a person, we are an open system. Okay, we have input, throughput, output, and then you have feedback. Next, we will be discussing now the psychological homeostasis. Kung yung kanina is about the physiological homeostasis, di ba we discuss about the four characteristics of physiological homeostasis, and then we discuss about the open and closed system. Now, let's talk about psychological homeostasis. Pag psychological homeostasis, it's about a stable physical environment in which the person feels safe and secure. So pag psychological, again, we're talking about emotional and psychological um, aspect of the person. So kapag feel natin na we are safe and secure in our physical environment, then that would be part of the psychological homeostasis. An example, the basic needs for food, shelter, and clothing that must be met consistently from birth onward. A stable psychological environment from infancy onward, so that feelings of trust and love develop. So psychological meaning, again, this is your social, I mean your mental, okay, your mental well-being from infancy onwards dapat is okay siya. And then social environment, that includes adults who are healthy role models. So definitely, alam naman natin na kung ano yung nakikita natin sa matatanda, definitely, most of the time, ginagaya siya ng mga bata. So, if you have more role models na mga adult sa iyong paligid, so definitely, you have a positive social environment that would influence your psychological homeostasis positively. A life experience that provides satisfactions. Throughout life, people encounter many frustrations, di ba? So, yung buhay, I mean, if your life is most of the time you are satisfied with what is happening, then psychologically, that you have a positive psychological aspect. Okay? Mas maganda yung iyong psychological homeostasis for that matter. Okay, now what are the criteria of mentally healthy person? So tingnan kung you possess this criteria para masabi, I mean, ito yung mga criteria na pwede nating masabi na you are a mentally healthy person. Okay? Positive attitude. Do you possess that positivity? Conscious of his or her actions. If you are conscious of your actions, acceptance of himself or herself, sense of identity, changes and grows throughout life, acts in a unified manner. So these are some criteria for your psychological homeostasis. So please be mindful of this para gumanda or parang mas maging psychologically healthy pa tayo. Okay? So be positive, accept yourself for who you are, be conscious of your actions, and then um yun, sense of identity acts in a unified manner, and then changes, you accept the change and you grow with maturity. So that's important. Now, ang two needs that are fulfilled by mentally healthy person, the need to be loved and be loved, that is very important, and the need to feel that one is worthwhile, so to self and others. So kung ikaw ay nagmamahal at minamahal ka rin ng mga tao sa paligid mo, that is important for you to become mentally healthy. And then if you feel na you are worthwhile, or like you are being valued by the person around you, then that is also and can be said na you are a mentally healthy person. Okay, a person fulfills these needs by doing that which is realistic, responsible, and right. So definitely, you should be. It must be within the bound of reality lang, and we have to be responsible and in rightful context, okay, or in right manner. Okay, next, we are now going to apply a theory here. Okay, so this is our first, again, this is maintaining homeostasis pa rin, ano, or balance. And in the concept of individual health and homeostasis, we have here si Maslow's hierarchy of needs. So let's discuss this. So this is very important for you to know. So Maslow's hierarchy of needs is an idea in psychology siya, and it is proposed by an American Abraham Maslow in his paper in 1943. So we have, according to him, we have um, five needs. Okay, hierarchical needs. Meaning, ano siya, step by step siya. Dapat ma-achieve mo muna. So, pakita ko muna, ito siya. Dapat ma-achieve mo muna tong lower levels bago ka makaakyat sa higher levels. Kaya siya hierarchical, kaya siya in hierarchy. Para siyang step by step until you reach the top. So, hindi ka pwedeng you go up first, tapos o kaya you go up in the middle, hindi rin pwede yun. So, dapat you start dito sa lowest part. So, we have five: physiological, safety, love, and belonging, self-esteem, and then self-actualization. So, let's start. The Maslow's hierarchy of needs. So, physiological needs, these are the needs such as air, food, water, shelter, rest, sleep, activity, and temperature maintenance. Okay, so meaning yung physiologic needs, these are the crucial needs for us to maintain life. Without this, definitely, we die. Kaya siya tinawag na physiologic needs. These are the basic needs of man. Okay, so air, food, water, shelter, rest, sleep, activity. Without this, again, you die, or hindi ka pwedeng umakyat to another level. So this is the physiologic needs. So dapat masatisfy natin yan. Next, safety and security needs. So this pertains to both physical and psychological aspects. So dapat ma-feel natin that we are safe both in physical and in relationship. Okay, so safety and security yon. Um, next, again, we have to feel safe physically in our environment. We are secured um, in terms of our family, in terms of our relationship. Next, love and belongingness. So this is the third level, which includes giving and receiving affection, attaining a place in a group, and maintaining the feeling of belonging. So meaning we are the third level, definitely if okay na tayo with the first level, second level, third level is love and belonging needs. So ito yung our our affective side. Okay? Yung at that we ito yung kaninang we love others and we feel love by others. Okay? So we this is the feeling that we belong to our particular group. So ito yung mga friends natin, ito yung loved ones natin, for example, your girlfriend or your boyfriend, and also definitely your the love coming from your family or from other person. Okay, you feel that you belong to a certain group. So, yon, physiologic, safety, and love and belonging. So, tapos na tayo. So again, I mean for the first three levels, ano, again, additional for the safety, it includes your shelter. Okay, so definitely if you have this for example, house, yung okay yung matutuluyan mo, definitely you feel safe and you feel secured. Another one is money. Okay, if you have this definitely mahalaga yung ating I mean financially, mahalaga yung pera to sustain our needs. Okay, so ayun. So ito yung first three na na-discuss natin. Physiological, safety, love and belonging. So yung love and belonging is about sexual intimacy, family, friendship. Okay? And then the fourth one is self-esteem. And the last one is self-actualization. So self-esteem needs, so the individual needs both self-esteem. This is the feeling of independence, competence, and self-respect. And esteem from others, the recognition, respect, and appreciation. So, ito yung masasabi nating tiwala natin sa ating sarili. Ito yung kakayahan natin bilang isang tao. At ito rin yung mga natatanggap nating recognition, respect, and appreciation from other people. So, mas tumataas yung ating self-esteem when we are recognized, when we are respected, and when we are appreciated by other people. And then self-actualization, this is the highest level. When the need for self-esteem is satisfied, so the individual strives for self-actualization. Tinatawag natin silang self-actualized person. Ibig sabihin, they develop their their own or one's maximum potential and realize one's abilities and qualities. So ito yung parang gusto nating ma-reach lahat ng tao. Gusto nating ma-reach itong need na ito, the self-actualization needs. We wanted to become self-actualized person. Kung saan parang na na-achieve na natin yung kumbaga naging fully satisfied na tayo. Okay? When it comes to our needs, self-actualization. Okay? So, ayun. So, again, the five levels of Maslow's hierarchy of needs: physiological, safety, love and belonging, self-esteem, and self-actualization. Okay, so ito siya, reaching yung pinakamataas na self-actualization, again, reaching one's potential. Okay? And then, ayan. Please refer to the figure na lang, ano, hindi na natin isa-isahin. Next, another subtopic. So, tapos na tayo with the individual health. Now, let's talk about health, wellness, and illness. Although kanina na-discuss na natin kahit papaano yung some terms will just dive deeper into these concepts. So health is a fundamental right of every human being. So lahat tayo has the right to have a good health. So some people may think of themselves as healthy and well if they are not ill, and then ill if they are not well. So sometimes gano'n yung notion natin about health ano. Healthy tayo kapag wala tayong nararamdaman na sakit. Tapos 'pag may sakit tayo, then that's the time na hindi tayo healthy, okay? Pero definitely again, the meaning of health varies from one person to another. Marami tayong definitions of health from, um, way back ng matagal na panahon nade-develop yung definition ng health. So, let's try to see the different definitions or concepts of health. So here, according to Walter Cannon, health is the ability to maintain homeostasis or dynamic equilibrium. So ito yung kanina na-discuss natin about homeostasis, the state of balance ng ating katawan, okay, that's being healthy. And then, according to Nightingale, it is health is being well and using one's power to the fullest extent and is maintained through prevention of disease via environmental factors. So for Nightingale, as a nurse, very significant sa kanya yung nagagawa ni environment sa ating katawan. Okay? Like the fresh air, sunlight, clean water, clean environment. So, definitely, ang laking influence yan sa ating health. Okay? So, yun yung primary na tinignan ni Nightingale in taking care of the sick, the environmental factors. Okay, so again, ito uli yung definition ni World Health Organization about health. A state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. So dapat by now, kabisado nyo na siya or you fully understood this meaning. Okay, so again, kung hindi lang natin, di mo, I mean, health is not just merely the absence of disease or infirmity. You can be considered healthy even though na ikaw ay may disease as long as, for example, you can perform your function or you can still perform your role as a person. So it is multidimensional. So we have different aspects of social health, well-being, and mental health. So let's discuss, and then you have physical health. So, definition lang ng terms, ano. So, wellness is a state of well-being. Again, wellness is a state of well-being. Pag sinabi namang well-being, it is a subjective perception of vitality. Okay? So, well-being is a subjective perception of vitality. And then, feeling well naman can be described objectively, experienced, and measured, and can be plotted on a continuum. So well-being is a component of health. And then disease, ito, mahalaga nyo rin itong ma-understand itong dalawang terms. Disease and illness. Pag sinabing disease, this is the objective dysfunction or alteration in functioning. So disease is an objective dysfunction. It is an objective type kung saan, for example, you are diagnosed, you are the physician told you, for example, that you have, for example, a lung problem or a lung disease. Pag illness naman, it is something subjective. Again, illness is a subjective dysfunction or alteration in functioning or the human experience of disease. So, illness, ito yung subjective feeling ng isang tao. Okay, illness, ito yung nararamdaman, ito yung subjective feeling mo. It comes from you. While yung disease, this is objective and ito yung nakikita ng ibang tao. For example, ito yung nakita na-diagnose ng doktor sa isang tao. Okay? So, pwedeng for example, you have the disease, for example, you have diabetes. You are diagnosed by your doctor na you have diabetes. That is objective. Pero if, for example, sa iyong sarili, you do not feel any problems at all, Okay? Then you can say na you are good, and that could be that is the side of the illness. Okay? Pero again, illness is subjective, ano? You have it is like the symptoms na nararamdaman mo. Okay? So it is your own perception, it is your own feeling. So that's the main difference between disease and illness. Okay, now we have different components of wellness. You have the environment. Definitely, ito yung mga nakakaapekto sa wellness natin. The environment, occupational. If you are, for example, working, or if you have something that you are doing na occupationally, intellectual, spiritual, physical, emotional, and social. This contributes all to our wellness. Okay, next, you have, di-discuss natin sila isa-isa very quickly na lang. So, environment, so definitely, it pertains to our environment, to our community. Okay? Social, again, ito yung how we interact with other people. Okay? So, our relationship with other people, so that is social. Emotional, this is how we manage our stress, express our emotions appropriately. Okay, and then you have physical. Pag physical, ability to carry out daily tasks, achieve fitness, and then maintain adequate nutrition and proper body fat, avoid abusing drugs and alcohol or using tobacco products. Spiritual, ito ulit yung ating faith, yung ating belief, like religion, science, nature. Okay, so it includes persons on morals, values, and ethics. Intellectual, so this is what we learn and how we use that information effectively for personal, family, and career development. And occupational, ito yung kanina, the ability to achieve a balance between work and leisure time. So occupational, it is something that we work, I mean, like our job or any occupation, and then leisure time. So so these are the 7 components of wellness. Okay, so after that, we now discuss the models of wellness. So we have several models of wellness. We have first the clinical model. So the clinical model is the narrowest interpretation of health. So people are viewed as physiological systems with related functions. And health is defined as the absence of signs and symptoms of disease or injury. So basically, pag sinabing clinical model, it is considered the state of not being sick. Kung ikaw I mean, healthy ka if you are not sick. Okay? And then, the opposite of health is disease or injury. So, very narrow lang yung perception or idea ng clinical model. Okay? So, dapat wala kang signs and symptoms of disease or injury for you to be considered as healthy. Role performance model naman, health is defined is in terms of individual's ability to fulfill societal roles, that is to perform his or her work. So if you are able, for example, to perform your roles, you are able to perform your role as a mother, a student, a brother, a sister, then that can be considered as healthy because nagagawa mo yung different roles mo. Okay? So that is your role performance model. Adaptive model naman, health is a creative process. So disease is a failure in adaptation or maladaptation. So kapag nagkaroon ka ng disease, ibig sabihin you were not able to adapt, okay, to a certain condition. So the aim is definitely treatment to restore the ability of the person to adapt. That is to cope. And then number four, eudaimonistic model. So for the eudaimonistic model or eudaimonistic model, um, it incorporates a comprehensive view of health. So ito yung mas sa apat, ito yung medyo comprehensive or medyo malawak yung sakop in terms of health. So here, health is seen as a condition of actualization or realization of a person's potential. If you would remember kanina yung kay Maslow's hierarchy of needs, diba? The highest level is self-actualization. So yung ganun din yung kay eudaimonistic model. Okay? So health, dapat health is a condition kung saan yung tao daw na-achieve niya na yung actualization or that self-realization na tinatawag. Okay? So, this is in line with Abraham Maslow's hierarchy of needs. So, illness in this model is a condition that prevents self-actualization. So, eudaimonistic model, again, we are geared towards achieving self-actualization. So that is health. Pero if something prevents you from achieving that self-actualization, then that is illness. Okay? And then next model is the agent host environment model or AHEM model. Agent host environment model. So it is also called as ecologic model, originated in a community from Leaville and Clark. And then we have three dynamic interactive elements for agent host environment model or the ecology model. So basically, we are referring to these three elements. Okay, so you have the agent, you have the host, and you have the environment. So agent, it is any environmental factor or stressor. Ito yung kahit anong stressor or kahit anong agent that could cause disease to us. Example, biologic, you have the bacteria or the virus. Chemical, example, kahit anong chemical like gas, dye, or anything. Mechanical, physical, or psychosocial that by its presence or absence can lead to illness or disease. Okay, so basically, an agent, it is something that could cause us harm or disease. Kagaya ng nga na sinabi ko like bacteria or virus. Host, so definitely it is a person who may or may not be at risk of acquiring disease. So ito tayo. Okay? So person. This is the host. So in our example, so definitely the agent is the bacteria and then the host is the person. So pwedeng kumapit sa atin yung bacteria because we are the host. And then the environment, all factors external to the host that may or may not predispose the person to the development of disease. Any example ng environment, physical environment that includes living condition, climate, sound or noise, economic level. Okay, so environment, basically, ito yung paligid natin wherein we live and definitely kung saan nag-thrive din or nagli-live din yung mga bacteria and viruses. So it's the interplay of these three elements for the agent host environment model. Okay? So ito siya ha, remember the AHEM the AHEM or the agent host environment model. Agent, the host and the environment. Next, health illness continua. So it can be used to measure a person's perceived level of wellness. So health and illness or disease can be viewed as the opposite ends of a health continuum. So ito ay si Dunn's high-level wellness grid. We have Dunn in 1959, which describe a health grid in which a health axis and an environmental axis intersect. So pakita ko na lang na I will explain this health illness continua or continuum in this figure. So we have here the environmental axis, okay, the x-axis, and then you have here the health axis or the y-axis. So nag-intertwine sila, no? Here, so for the health axis, here, dito sa red na to, this is ito yung poor. Ito yung hindi maganda in terms of health. For example, I mean, this is the poor health. Okay, this is the poor health. And then as you go along the continuum, okay, gumaganda, I mean, mas nagiging healthy. And this is, the end here, yung kulay green, is the peak or the wellness side. So again, yung dulo dito, under the health axis, is the poor health, wherein pag hindi na correct, will eventually lead to death. Okay, so poor health, and then as you go along the continuum, you have here the peak wellness at the end of the continuum. So that is the health axis, ano? And then for the environmental axis, the lowest part is an unfavorable environment. And as you go up, you have here the very favorable environment. Okay? So now, sa pag-intersect ng health and environmental axis natin, we have parang four corners na nabuo. So under this peak wellness, health axis, and very favorable environment, itong side na to, this is the high level wellness na kung tawagin. Okay, high level wellness in favorable environment. On the other side naman, you have your very favorable environment, pero you have your poor health. Okay? Ito yung protected poor health na tinatawag. Okay? So, hindi maganda yung health mo, pero yung environment mo is favorable. For example, you have your family support, you have the healthcare delivery system support, you have access to hospital, you have good environment. Kaya lang, hindi maganda yung health mo. Pero definitely, it can be improved since you have a favorable environment. Dito, in high-level wellness, we just have to maintain the good environment and the good perception about health that we have. Dito, all we need to do is since meron tayong favorable environment, all we have to do is to improve our health. Okay? And then, going down, ito yung hindi maganda among the four sides or corners. Very unfavorable na environment. Tapos, poor pa yung health mo. So, definitely, ito yung ayaw nating mangyari. Okay? We have poor health, tapos poor pa yung environment natin. Example dito, yung mga people living in poverty, okay? And then mga hindi pa nakapag-aral na tao, for example, tapos wala pang kakayahan, wala pang pera. So, most of the time dito sila nagko-fall. And then emergent high-level wellness, ito naman, they have good health, pero yung kanilang environment is poor. Ito, madali lang solusyonan. I mean, hindi siya ganun kadali because we have to correct the environment. And correcting the environment, if for example, you are poor, tapos you have a bad physical environment. So, mahirap ma-maintain yung health mo if that is the case. Okay? So, yun yung the four aspects or corners kapag in-intersect natin si health and environment axis. Now, these are the examples of the health illness continua or continuum na pinag-uusapan natin kanina. Okay? So, na-discuss ko na siya kanina. So, I will just leave this reading to you. So kindly read na lang this slide. Pero I already discussed yung concept na to and the examples a while back. Next, we are now discussing the different variables influencing health status, beliefs, and practices. So, tapos na tayo with the individual health. Tapos na tayo with wellness, illness, and health. Now, we are discussing the different variables that would influence health status, beliefs, and practices. So, first, definition muna tayo. Pag sinabing health status, this is the state of health of an individual at a given time. So, health status, ito yung kondisyon ng health mo as of the moment. For example, you are depressed today, you have high level of anxiety, or ikaw ay may nararamdamang sakit, then that is your health status as of the moment. Health beliefs naman, these are concepts about health that an individual believes are true. But these beliefs may or may not be founded on facts. So ito yung pinaniniwalaan natin about health. These are the beliefs that we have that affects our health. Okay? Most of the time it is influenced by our culture. So another health behaviors. So the actions people take to understand their health state, maintain an optimal state of health, prevent illness and injury. So these are the behaviors such as eating wisely, exercising, paying attention to signs of illness, avoiding smoking, or taking time for rest and relaxation. So these are examples of effective health behaviors. Okay? So, ito yung mga ginagawa natin basically that could affect our health. Okay? So, if you exercise regularly, if you eat nutritious food, then that's a good health behaviors. Okay, so internal variables, ito yung sa kanina, ano? Internal variables that influences our health status. We have biologic dimension. It includes the genetic. So, itong mga internal variables pala, most of the time, they cannot be changed. Okay? Hindi na siya nababago. Kung ano yung meron tayo, yun na yun. For example, itong biologic dimension, yung genetic makeup natin, we cannot change that. Our sex, either male or female, we cannot change that. Age natin, we cannot change that. So that's under biologic dimension, which really affects one's health. Psychological dimension, this is about the mind and body interactions and self-concept. So we have discussed this earlier. Cognitive dimension, this is the intellectual factor that influence our health. So these are all internal variables. Okay, again, you have your biologic, your psychological, and your cognitive as internal variables. External variables, ito yung mga outside or the external factors that influence us as a person. You have the environment, kanina pa natin na-discuss the standards of living. Ito yung ating, for example, economic status, okay? And then, also includes our education, our occupation, our income. Family and cultural beliefs. So we have discussed this earlier, and social support networks such as our friends, families that influences our health. So these are all external variables. Next, illness and disease. So let's just define again illness and disease. Pero kanina na-discuss na natin to, di ba? Sabi natin kanina, illness is more on the subjective dysfunction. Disease is like an objective dysfunction. Di ba? Yun yung definition natin kanina. So this is another definition. So illness is a highly personal state. Personal state meaning yun nga subjective state siya na nararamdaman ng isang tao. Disease, it can be described as an alteration in body functions resulting in a reduction of capacities. or a shortening of the normal lifespan. Etiology is the causation of a disease or condition. Okay, etiology. Iyon yung definition natin, ano, yung disease causation or condition. So, yun yung tinatawag na etiology. Okay, classification of illness and disease, we have two, acute and chronic. Pag sinabing acute, ito ay biglaan. Okay? Acute illness, bigla ka na lang nagkaroon ng sakit. Typically characterized by symptoms of relatively short duration. Mabilisan lang siya. Tapos, appear abruptly and subside quickly. Biglaan ka nagkaroon, tapos biglaan ding nawala or na-resolve din agad. Okay, that may or may not require intervention by healthcare professionals. So, acute illness. Bigla kang nagkasakit, tapos pag naka-recover ka agad, then we call that as acute illness. Now, gaano katagal? Tignan natin muna yung chronic illness. Chronic illness kasi it lasts for an extended period, usually 6 months or longer. So, meaning, from 0 to 6 months, yung sakit mo, okay, that can be considered as acute illness. Again, nagkaroon ka ng illness from zero or I mean day 1 up to 6 months. I mean, na-resolve din siya before or on 6th month, then that can be considered as an acute illness. Pag chronic illness, usually 6 months or longer. So more than 6 months, that is chronic illness na. Nagkasakit ka for example ngayon, tapos tumagal siya for more than 6 months or longer, then that is chronic illness. Chronic illness have a slow onset and often have periods of remission. So, an example of a chronic illness na medyo pang matagalan na is like a diabetes mellitus or yung mga nagkakaroon ng diabetes. Okay? Sometimes sa mga bata, asthma. Tumatagal din yan for a certain period of time. Pero kapag tumatanda yung isang I mean, yung bata, parang nawawala rin siya. Okay? It has something to do with like the immunity of the person or the corrective measures that one has undertaken para mawala yung asthma. Okay? So, what else? For example, stroke. Okay? Pwede kang ma-stroke for a certain period of time, pero the rehabilitation may take for a long period. Okay? So that may be also considered as a chronic illness, especially kasi pag hindi na correct yung yung etiology or yung disease causation of stroke, so pwede kang ma-stroke ulit, 'di ba? Nangyayari yan sa ibang tao talaga. So that can be considered as a chronic illness as well. Okay, so illness behavior, it's a coping mechanism, involves way individuals describe, monitor, interpret their symptoms, take remedial actions, and use the healthcare system. So illness behavior, this is our response to any illness. Okay? Para maayos yung symptoms na nararamdaman natin. It's a coping mechanism. Okay. Next, you have the Parsons four aspects of the sick role. You have rights and you have obligations. So for the rights, you have two aspects. Obligations, you have another two aspects. That's why four aspects of the sick role. One, under rights, clients are not held responsible for their condition. So, again, kapag ikaw ay nagkasakit na, no? Pag sinabi nating four aspects of the sick role, kapag ikaw ay nagkasakit na, so these are the different aspects that you have that must be considered. So rights, ibig sabihin, it's like you are privileged. Okay? I mean, rights is different from a privilege. Rights, ito yung karapatan mo talaga Yung privilege naman is given to a certain people because of certain achievement. Okay? So yung rights, ito ay due, duly given to all person. Rights siya. Pero ito, rights for the sick role. Okay, so rights, clients are not held responsible for their condition. Even if the illness was partially caused by an individual's behavior, for example, lung cancer from smoking, the individual is not capable of reversing the condition on his or her own. Okay, so definitely pag tayo nagkasakit, we are not held responsible for that condition. Okay? That is the right of a sick role. That's the first. Second, clients are excused from certain social roles and tasks. Siyempre, if you're already sick, you can be exempted from your roles or from your responsibilities. Okay? Kasi nga, you're already sick. And that is a right of a sick person. Now, obligations naman of a sick person, clients are obliged. So definitely if you have the rights, you are obliged ngayon to, as a sick person, you are obliged to try to get well as quickly as possible. Definitely dapat magpagaling ka. You're obligated to your own health. Okay? And then number 4, clients or their families are obliged to seek competent help. You as a sick person or yung support mo of your family, you are obliged to seek help, okay, to medical professionals. Okay, para ma-solve yung iyong sakit. Okay, so these are the 4 aspects of the sick role according to Parsons. So again, you have 2 rights of the sick person and yung obligation naman ng dalawang obligation ng sick person na dapat magawa. That's according to Parsons. Next, you have Sapman of 1979, 5 stages of illness. So we have, kapag ikaw ay nagkasakit or naging ill, we have 5 stages. Okay. So first, you have stage 1, the symptom experiences. So ito yung na-experience mo na yung symptoms. Again, symptoms are subjective. Ito yung na-experience ng isang tao. The person believe that something is wrong. So, na-experience siya na, for example, nagkaroon na siya ng pain, nagkakaroon ng rashes, coughing, fever, or bleeding. Or minsan, sinasabi ng ibang tao na mukhang may sakit siya, mukhang hindi okay yung kanyang pakiramdam. Okay? And then, the unwell person, okay, consult others about the symptoms. Nagtatanong-tanong siya. For example, ano ba yung mga sintomas ng, for example, ano ba yung mga sintomas ng may COVID virus or na ng positive COVID, 'di ba? So at this stage, the sick person may try home remedies. So yung unang stage, yung tao na magkakasakit ay na-experience na yung symptoms. Okay, may symptoms na, may subjective feelings na nararamdaman about illness. Now we have 3 aspects of symptoms experiences. You have the physical experience of the symptoms. Physically, may nararamdaman na siyang symptoms. Cognitive aspect. So, parang naiisip niya na um, parang may mali sa kanya, may problem siya because may nararamdaman siyang symptoms. And then, the emotional response, natatakot siya, there is a fear or na-anxious siya of what is happening to him or to her. Next, stage 2, the assumption of the sick role. So dito, the person now accepts the sick role. Tinanggap niya na, kasi may naramdaman na siyang simptomas, tinanggap niya na may sakit siya. And seeks confirmation from family and friends. So nagsisik na siya ng support from other people at this time. So often people continue with self-treatment, nagsi-self-medicate, inaalagaan muna yung sarili and delay contact with healthcare professionals. So hindi pa siya In stage 2, hindi pa nagpapa-consult sa hospital, for example, or to a healthcare professional. Pero when symptoms of illness persist or increase, the person is motivated to seek professional help. At doon na papasok yung stage 3, medical care contact. Okay? So dito yung sick people seek advice from healthcare professional. Okay? Either from their own initiative or na napilit sila ng kanilang significant others. So three types of information should be obtained: validation of real illness, explanation of the symptoms in understandable terms, and reassurance that they will be all right. So, ito yung tinitingnan ng mga healthcare providers during the medical care contact. Pina-validate yung illness, pinapa-explain yung ine-explain yung symptoms, and then inire-reassure that everything will be all right. And then stage 4 naman is a dependent client role wherein si patient na, okay, yung taong nagkasakit is dependent na to the healthcare professional. Okay? Talagang he or she um, parang pinaubayan na mapagaling siya ng mga healthcare provider. Okay? So sila nang bahala sa treatment na gagawin. So that is stage 4, dependent client role. Stage 5 is about recovery or rehabilitation. This is about the client is expected to relinquish the dependent role and resume former roles and responsibilities. So stage 5, naka-recover na, gumaling na si client. So hindi na siya ngayon dependent, siya na ay magiging independent na ulit. Kaya niya na uli yung sarili niya. Recovered na siya, or recovering na siya, and then rehabilitating. So these are the 5 stages of illness according to Sackman. Okay? Now, another subtopic under chapter 1 is healthcare delivery system. So we know, after discussing after discussing the individual health, the health, wellness, illness and disease, homeostasis, and different concepts, we now discuss the healthcare delivery system. Okay, so we are part of this as a nurse, or you will be part of this as a student nurse. Okay, so healthcare delivery system is the totality of services offered by all health disciplines. So the major purpose is to provide care to people who were ill or injured. So yun yung purpose, to provide care sa mga may sakit or na-injured. So primary healthcare focuses on improved health outcomes for an entire population. So it includes primary care and health education, proper nutrition, maternal child, family planning, immunization, and control of diseases. Now, for the levels of disease prevention, we have 3 levels of disease prevention. We have primary, secondary, and tertiary. Discuss natin siya isa-isa. Again, these are the levels of disease prevention. First level is a primary prevention. The focus of primary prevention is health promotion and illness prevention. Now, the goal is to increase quality and years of healthy life, achieve health equity, and eliminate health disparities. Create healthy environment for everyone, promote health and quality across lifespan. So dito, for primary prevention, dito tayo nagbibigay ng proper nutrition, weight control and exercise, and stress reduction. Yung mga example nito, yung mga exercise, yung Zumba, that is another primary prevention. Okay? Yung mga tawag natin, most of the time sa school, di ba, nagkakaroon tayo ng feeding program. So that could also be part of the primary prevention. Okay? So dito, we wanted to maintain health and then encourage people to maintain health as well. Okay? So again, our focus here is health promotion. We want everybody to maintain that good health by exercising, by eating healthy foods, living a healthy lifestyle. The next type of prevention is secondary prevention, which the focus is diagnosing and treatment. So the largest segment of healthcare services was dedicated to the diagnosis and treatment of illness. So physicians offices have been major agencies offering these complex secondary services. So itong secondary prevention, dito na tayo nagda-diagnose ng sakit at definitely nagte-treat ng mga sakit. Ano-ano yung mga It also includes health promotion services such as early detection of disease. Okay, ano ba yung mga early detection services like regular dental examination, um, at a bone density studies for women at menopause to evaluate for early osteoporosis. Ang common din na example ng secondary prevention is the screening for breast cancer by the use of mammograms sa mga babae. So that's one way to detect if you have cancer or wala. So mga screening natin, dito yun for secondary prevention. Okay? So next would be tertiary prevention. So for tertiary prevention, you have here to help people move to their previous level of health. So the highest level they are capable of given their current health status. So dito ang goal natin is to rehabilitate, to restore health or to give palliative care. Okay, so rehabilitative care emphasizes the importance of assisting clients to function adequately in physical, mental, social, economic, and vocational areas of their lives. Dito nagkasakit na si patient and then um, pinapagaling natin sila, nire-restore yung health, nire-rehabilitate at um, nagkakaroon ng mga follow-ups. Okay, so that is tertiary prevention. Sa kanina, yung primary prevention, another example is immunization. So immunization, again, is an example of a primary prevention. So yun yung ating three levels of prevention. So primary, secondary, and tertiary. Next, we have the types of healthcare services. So ano-ano yung mga healthcare services na pwedeng puntahan ng mga may sakit. So here in the Philippines, commonly we have hospital. So we have here acute inpatient services, outpatient clinic, inpatient, ito yung mga pwedeng ma-admit. Okay? Outpatient, ito yung mga yung mga pumupunta tapos nakakalabas, pupunta and then lumalabas din agad. Mga nagpapa-check up lang. Okay? Tapos pwede nang umuwi after. Kasi pag inpatient, ito yung mga na-admit talaga sa hospital. Ambulatory care services, ito yung mga lang din, mga pangmabilisan na health services na pwedeng ibigay sa hospital na nakakaalis din si si patient or si client, and emergency department services. Okay, so that is for the hospital, and that is the most common setup that we have here in the Philippines. Hospice services or hospice services. So this is for patients who are terminally ill. Okay, yung mga naghahantay na lang ng kanilang oras because of, for example, cancer na late stage na. So, dito natin sila dinadala, hospice services. Public health, ito yung definitely initiative ng government agencies at the local and state level here in our country hanggang ano lang tayo, we have local and state. Okay? Local government and then the the state na. So we have, ayun, these are the different programs na ginagawa ng ating gobyerno para sa ating kalusugan. So public health services provided to the public. Now we have R8 1082, also known as Rural Health Act. Implemented in 1953, it called for the employment of RHU personnel or the Rural Health Unit personnel. And who are these personnel? Physicians, dentists, nurses, midwives, sanitary inspectors. So sila yung mga nakikita natin sa most of the time sa munisipyo or sa, kasi katabi lang ng munisipyo most of the time si RHU. Or minsan, for example, si physician, nag-o-office siya sa munisipyo if that is the case. So they are called the RSU personnel. Ano? We have si RSU nurse, si midwife, okay? So they are assigned to, I mean, in barrios to help alleviate their health conditions. So bawat sa atin in bawat municipality and in some cases kung mayaman yung ating lugar, we have our own per barrio. Okay? Pero very seldom yun, especially sa mga isolated place. Okay, ambulatory care center, we do not have here in the Philippines. I mean, for the ambulatory care centers, meron na tayo nito. Um, very few offers this as especially sa mga developed cities. So these are used in many communities. Pero in abroad yun, in setting, many communities are available in abroad. Sa atin, in our case, we have ambulatory care center or yung mga tinatawag nating parang clinic on wheels. Let me just check, yeah. Parang mga clinic on wheels or yung mga nakikita nating on wheels na for example, dental check-up, tapos nagpo-provide ng laboratories, okay, laboratory services, medical services na on wheels. So we call that, pwede siyang ma-consider as ambulatory care center here in our case. Okay, meaning ambulatory, I mean the services is temporary. Okay, panandalian lamang siya. Okay, and then occupational health clinics. Ito yung mga clinics or yung mga nagbibigay ng healthcare services sa mga lugar na pinagtatrabahuhan natin. Okay? So, occupational health clinics. Extended care facilities. Ito ay, for example, sa atin sa mga senior citizen or sa mga taong may kapansanan. Okay? Yung mga home for the aged. So that can be considered as extended care facilities. Yung mga walang nag-aalaga sa kanila, diyan dinadala. Retirement and assisted living centers, uncommon yan dito sa atin. So, yan, commonly sa ibang bansa meron yan. Sa atin, most common yung extended care facility. Rehabilitation center, ito yung mga rehab. For example, sa mga drug addicts, diba? For some communities here in the Philippines, we have rehabilitation center for especially mga addict or for mga alcoholics. Daycare centers, ito yung mga pinag-iiwanan natin, di ba, sa mga children, sa mga infants while their parents are away. So, piniiwan natin sa daycare center. Rural care, it provides emergency care to clients in rural areas sa mga liblib na lugar. Crisis center, it provides emergency services to clients experiencing life crisis. Now, who are the providers of care? So definitely us nurses. Okay, so alam niyo na definitely ang pinakamalaking working force in healthcare industry are nurses. So in other countries, you have different types of nurses. Meron silang LVN, Licensed Vocational Nurse, Licensed Practical Nurse or LPN, and then yung kanilang registered nurse, tapos meron pa silang advanced practice registered nurses. So sa atin, here in our case, the Philippines, we only have RN or registered nurses. Okay? So, tapos assistant nurse na, tawag dito, nursing aid. Again, here in the Philippines, we only have nursing aid, and then you have registered nurses. So tayo, definitely yung mga license. Si nursing assistant or nursing aid, they are unlicensed. Next, alternative care provider, alternative or complementary healthcare. Ito yung mga chiropractors, herbalists, acupuncturists, massage therapists, reflexologists. Okay, yung mga um, not commonly considered part of Western medicine. Next, case manager. Um, Common yan sa ibang bansa. I'll just leave up to you the rest of the readings. Dentist, so you already know what a dentist does. Dietitian or nutritionist, emergency medical personnel such as yung mga um, medical emergency medical services agencies like the fire departments. Occupational therapists, okay, ito yung mga nag-a-assist sa mga clients with impaired function. Paramedical technologies, we have laboratory technologies, kasama natin yan sa ospital. Radiologic technologies, and then nuclear medicine technologists. Okay, kindly read na lang thoroughly. Pharmacy, so definitely sila yung mga nagpe-prepare and nagdi-dispense ng drugs most commonly in the hospital. Okay, pero here in our case, sila yung nagbibigay, here in the Philippines, sila yung nagpagbigay or kinukuha na natin ng medicine. Physical therapist, so they assist clients with musculoskeletal problems. Physician, they are what we call our doctors commonly. Okay, so sila yung nagdi-diagnose and determine the treatment or therapy required by a person who has a disease. Podiatrists, they are doctors of podiatric medicine. They diagnose and treat foot and ankle conditions. So remember that, podiatrists. We also have respiratory therapists, skilled in therapeutic measures used in the care of clients with respiratory problems. So commonly, specialize sila in terms of respiratory problems. Social worker, so they counsel clients and their support persons regarding problems such as finances, marital difficulties, and adoption of children. So ito yung most commonly tinatakbuhan natin pag may problema tayo sa pera, di ba, in the hospital. Social worker. Spiritual support personnel such as chaplains, pastors, priests, and other religious spiritual advisor. Unlicensed assistive personnel or UAPs. So, ito yung mga hindi lisensyado and they are providing basic client care like bathing, feeding the patient, and collecting specimen. Okay, so what are the factors influencing or affecting healthcare delivery? Increasing number of older adults. So, dumandami yung mga aged population natin. So, that affects the healthcare delivery. Advancements in technology. Mas nagiging high-tech na tayo. We have nursing informatics, economics, women's health, uneven distribution of services, access to health insurance, homeless and the poor, Health Insurance Portability and Accountability Act. This is in the United States, and demographic changes. Okay, for lesson 2, very quickly, it talks about the concepts of nursing. So dito, we have what is nursing. So it is defined by Florence Nightingale as the act of utilizing the environment of the patient to assist him in his recovery. I have mentioned a while back, di ba? Si Florence Nightingale, mahalaga sa kanya yung environment to assist patient. and recovering his health. Was Virginia Henderson, it is another, a theorist and a pioneering leader in nursing. So the unique function of the nurse is to assist the individual sick or well in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge. So, ito yung kanilang itsura. So, we have here, definitely, the lady with the lamp, Florence Nightingale. And then Virginia Henderson, we call her the first lady of nursing and the Nightingale of modern nursing, the modern day mother of nursing. Okay? So, yun yung kanilang definition of nursing. So other definition, nursing is caring, nursing is an art, nursing is a science, nursing is a client-centered, nursing is holistic, nursing is adaptive, nursing is concerned with health promotion, health maintenance, and restoration. And nursing is a helping profession. Now, ano-ano yung scope ng nursing? So we promote health and wellness. Siyempre, we enhance healthy lifestyle such as improving nutrition and physical fitness, prevent alcohol and drug abuse, prevent accidents and injury in the home or workplace. So gusto nating mapangalagaan yung kalusugan ng bawat isa. That is the promotion of health and wellness. So you go back to the primary prevention kanina. 'Di ba we have levels of prevention? Primary prevention that can be inculcated here sa promotion or promoting health and wellness. Next, preventing illness. This is immunization, prenatal, and infant care. So, yun din, primary level of prevention. Next, number 3, restoring health. So, definitely, we aid in restoring health, early detection of disease through helping the client during recovery period. So, for example, giving medication, BP taking, pain or suffering. So, we help patient to from relief from pain and provide comfort. And then caring for the dying, so creation of spiritual environment sa mga hindi na kayang ma-extend ang life, meaning terminally ill na, we care for them. Okay? Palliative care ang tawag. Now, the nurses provide care for 3 types of clients. So we have individuals, families, and communities. So usually, these are our clienteles. So we have individuals, yung families, and then you have the whole community. Or the community as a whole. Okay, so roles and functions of the nurse. Di ko na isa-isahin, I will leave it up to you to read the different roles and functions natin as a nurse. So definitely, we are the caregiver. We are a communicator. We serve as a teacher. We are a client advocate. Okay. We are caregiver because we're taking care of the patient. Communicator because we communicate to them how they can prevent the disease. We give them health education. We teach them as a teacher. Okay, as a teacher, again, we teach them. We give them health education. Client advocate, we protect the client and we prioritize the health of our client. So that's being client advocate. Counselor, we counsel the patient as much as they need so that we can prevent the recurrence of the problem. Change agent, we wanted the patient to modify their risky behavior. Okay? Leader, we influence to work together to accomplish a specific goal. Manager, the nurse manages the nursing care of individuals, families, and communities. And then case manager, research consumer. Okay, so because as a nurse, we are conducting research. Okay, kayo as a student, di ba you have your nursing research as your subject. Expanded career roles. So this one is in the case of the other countries. So common to in the United States. So sa kanila, they have expanded career roles. Ito yung other roles of nurses, meaning higher education yung ginawa ng isang nurse to achieve this. They can be nurse practitioner, clinical nurse specialist, nurse anesthetist, nurse midwife, nurse researcher, nurse administrator. Okay? So tayo, we have naman nurse researcher and nurse administrator. Pero itong apat, si nurse midwife, and then nurse anesthetist, clinical nurse specialist, and nurse practitioner, commonly in the United States and other countries, ayan, meron sila niyan. Okay, and then nurse educator, nurse and entrepreneur. Okay, and that's it. So again, I will leave yung mga hindi ko tinakal masyado. Please read everything on my PowerPoint. I will be giving you I will be sending you a copy of my PowerPoint. So that would be all for the discussion of chapter 1. Thank you and God bless.